Sorry, are you here with them on this time? Are you here with them on this time?
Yes.
Action Association to reach out to Nigerians through the churches and the mosques, to create awareness on what they can do, to control. For the flood areas, we have sent nets to those places, and we are also sending more of the ACTs. It's a package for you, sir. Yes, sir. If you want to be tested, you can also test it.
We want to push down something.
See something behind.
the moderator here, but you have an opportunity to ask clarifying questions, specifically related to what we have done this morning. Nothing beyond that. And we have a distinguished panel represented by the Prime Minister of Norway, who is also the Secretary General of NORAD, someone that you know, the Executive Director of UNFPA, Deputy Executive Director of UNICEF, and Ms. Chelsea Clinton, who is board member of the 20 Health Access Initiative. So I would ask my panelists to just say a few words, and then I can move on to you to ask questions. So,
I just want to say what a privilege it is to be here on a topic that the government of Norway and the Prime Minister in particular is very, very committed to. It starts with Millennium Development Goals 4 and 5. We're putting in considerable funds. We are increasing these funds. And as you heard today, we are also committing $25 million for the saving a million lives. And we are constantly working together with our partners to find new, cost-effective and more innovative ways to do this. And I think it was said here today, if we go together, we go further. And we profoundly believe in this. And I also want to thank our partners, and here in particular, what we are doing together with Nigeria, the leadership role that Nigeria is demonstrating in Africa. It brings hope, and not least, it brings hope through implementation. We've seen results. We've reduced women's mortality when giving childbirth by 40% over the last couple of decades. This is impressive. This is something that works. This is something we truly believe in.
Thank you very much. Good afternoon. I would take off from where the representative of the Prime Minister just ended, to underscore the fact that when Nigeria succeeds, Africa succeeds. 1 out of every 4 Africans is Nigerian. And that implies that we have such a substantial contribution to make to progress in Africa. And I think with the leadership of President Jonathan and under the rubric of the UN Commission and, of course, the Saving 1 Million Lives, which seeks to bring all of this together. Because I think we've done several things in the last year. The Child Survivor Summit in Washington, D.C., the Family Planning Summit in London, the Commission report that was submitted in September, and the Education First. All of them speak to human capacity development, and when we want to learn from the example of Norway, building human capital is probably the most important going forward. And if we can do it in Nigeria and show evidence of success and progress, I believe that it will be a good thing. That's one. Second, of course, is that we are very happy in the international system that Nigeria as a country is actually putting more domestic resources for this to happen. It's one thing to make political commitments. There is another to go beyond the rhetoric of political commitment and actually put resources. And listening to the President today, it gives us great joy that is happening. And we at UNFPA, we're here to provide assistance as much as possible in looking at the issues that the coordinating Minister of the Economy talked about in terms of the demographic dividend, providing reproductive services, making sure that every child that is born is wanted, every pregnancy is safe, and every young life reaches his or her potential.
Thank you very much. just wanted to reiterate the fact that this morning was definitely a historic and very inspirational morning, because we have talked for many years and across many events now about doing something about this inexcusable fact, which is that mothers die giving birth and that children die of totally preventable causes. So the message today is that the world is going to find a way to end preventable deaths, and that we have the means, we have commodities that are available, they just don't necessarily reach those who most need them. And that's what the Commission for Life-Saving Commodities looked at. What are the barriers, what are the bottlenecks that stand in the way of essential commodities that somehow continue to be underused? It's often not pricing. Many of these commodities are quite cheap. Some, it is price, it is cost. In other cases, it's that there's no demand. In still other cases, they not sort of get the appropriate, they don't get the appropriate regulatory clearances quickly enough. So there's much to be done, and the Commission, the commissioners under the leadership of Nigeria and Norway came together to come up with very specific 10 recommendations on what can be done that have now been translated into an implementation plan. UNICEF will continue to work on implementing those recommendations with countries around the world, but Nigeria is now a priority because, as you saw, the political commitment is all there. There is a window of opportunity, and certainly, as Dr. Babatunde said, Nigeria is a role model, a leader, can serve as by example to show that this problem can be addressed and mortality can be reduced. So with regard to immunization, with regard to polio, specifically within that, and all as diarrhea, pneumonia, malaria, HIV infection, especially that's transmitted from mothers who are living with the infection to their babies. These are all things we can do something about, and UNICEF will work with Nigeria shoulder to shoulder to make sure that we address all of the barriers that currently stand in the way of Nigeria achieving success. And with the political commitment, we have no doubt that we're going to see success in a few years.
Nigeria isn't only an example of where Africa could go, but really where the developing world and the emerging market economies can go. 10% of preventable child deaths occur here in Nigeria, and so certainly closing on the 1 million lives saved, and I was so encouraged to hear that already 138,000 lives have been saved through increasing the penetration of malaria prophylaxis, through increasing vaccine coverage. It clearly shows that it can be done, and it's something we must do, because as Gita just said, so often it's not price that is the inhibitive barrier. It's rather questions of organization and logistics and supply and distribution. So one of the areas that CHI is working most closely with the Ministry of Health now in trying to scale up coverage of ORS zinc. Even the high-end estimates only put current coverage at 5%. And that's the high end. So we know that if we can get above 80% geographic coverage, we can cover the vast majority of the country's population. And we really believe that we can get to 100%, which should allow ORS zinc to become even more affordable and to help prevent hundreds of thousands of unnecessary childhood deaths in the next years alone.
Well, actually with civil society organization, Communication for Development Center. And I want to personally thank you for seeing to my participation here. Thank you, sir. My question is one, but as one A and one B. Considering the fact that there's a lot of discussion now around post-2015, I want to ask, the Save 1 Million Lives, are there discussion to ensure that it is sustained beyond 2015? And the part B of my question is the critical role of civil society in achieving these objectives, sir. how do we ensure that we improve the effective engagement of civil society in the discussions and in the implementation? Thank you, sir.
Obaloya, I write for the Sun newspaper. My question goes to Ms. Clinton. In all of this, I did not hear the contribution of the Clinton initiative in terms of funding. Is there a specific amount that is coming from the Clinton initiative for this?
My name is Tony Aileme. I write for Business Day Media newspaper. My question has to do with getting the governors and the various local government chairmen involved in your program. I am surprised that the governors are not even here. There was a representative was saying, and it was the Director General of the Governors Forum. And when you look at this issue on ground, you discover that when you go to the rural areas, a lot of efforts need to be put in place. You need to be able to carry them along. They have to play very strong roles in ensuring that not only that these things are properly implemented, they must support your program, especially at the grassroots level, because the ultimate beneficiaries of these are the women and the children at the local level. So I don't know what you are doing in getting them to participate with you.
My question goes to the Minister of State for Health. As the President, in the course of his speech just now, regretted the fact that Nigerian children are still being paralyzed by polio. I'm just wondering, whether the government will consider, enacting a law that could compel these conservative elements that are preventing their children from being immunized, to immunize them. Will the government consider taking action, strong action through legislation against such people that are bringing in culture and religion in the attempt to stamp out poliomyelitis in the country?
Access Initiative is actually an implementing partner. So starting in 2007, when we began working on pediatric HIV/AIDS, this year we worked with the Ministry of Health on the pentavalent vaccine rollout, and next year when we'll work with the Ministry of Health on the pneumonia vaccine rollout and on expanding ORS zinc coverage, for example, and continuing in our HIV/AIDS work. All of that work is funded by our funding partners. So by the Norwegian government, by the Bill and Melinda Gates Foundation, for example. And much of our pediatric HIV/AIDS commodities here have been funded by Unitaid. So we have about a couple dozen staff here on the ground in Nigeria who work throughout the country. And clearly, as our partnership with the Ministry of Health expands, and hopefully as we can continue to find technical and funding partners like the Norwegian government, our staff presence here will grow to meet those needs.
Because I think in all that we do in development, we see this as national movements, not as government. And that implies that we must bring on board civil society, and that came across today very clearly. We had private sector, we had community leaders, we had religious leaders, and I think it's a demonstration of the commitment to having stakeholders be part of this. And from the UNFPA perspective, and I'm sure that UNICEF and all the others who are partners in the UN system would also agree that this is not something you can do either as multilateral or bilateral alone. I think it's all of us. So in rolling out this implementation plan, I expect that civil society will be part of it, either in terms of doing, like CHI, or in terms of monitoring, and in terms of holding people accountable to what they've actually committed themselves to, including governments. And I think that that's the role that I expect civil society to play. And one good example, which I believe we can actually use immediately, is the issue of ending mother-to-child transmission of HIV. I mean, that's something which civil society can actually run with and do something about. With regards to post-2015, I think that it is nice that we are focused on trying to achieve the MDGs, because we still have 3 years and 3 months. And I don't want us to lose sight of the fact that we can accelerate this and actually do something in the next 3 years. But it is also important that when you look at the construction of the MDGs, it sought to do things within society in terms of making great changes. But let me take the example of poverty. What we wanted to do was to alleviate poverty in 50%. That means that there are still 50% out there that are poor. So I don't think the job will be finished by 2015. And I believe that we must insist that the spirit of the MDGs be rolled over into the next development space, especially with regards to women and children. The rights of women, the rights of girls, the rights of adults and girls, their education must be front and center in the next development space.
Thank you for these questions, and let me just add on to what was just said. We will continue to make women and children a priority. We will not be looking at artificial dates, but we will be working with other countries, other stakeholders to continue to attack this problem as long as it is there in the way it is today. And for us, if we look at how our society was built, it's about equal access. It's about every woman and every child, wherever they are in the country, accessing this. This is key, and let me here pay a particular tribute to civil society. You reading of what is happening on the ground, in families, your understanding, how you can also help to have the attitudes in local societies where there is a positive willingness to receive this and also other products that are vital to the health of women and children. So thank you so much for what civil society is doing for this important joint agenda.
Just to comment, thank you for those questions, and I want to also build off the other answers to the civil society question, because there's, from every other success story in international development, we've seen that it cannot happen without civil society engagement. That it's the role of civil society to hold governments accountable. It's the role of civil society to keep track, to reach communities, to inform, to organize, and for this saving 1 million lives to work, it has to engage civil society, and civil society should take the leadership and the initiative to begin to do that here in Nigeria as well as in many other countries. With regard to the question on polio, sir, just to say that while it's very tempting to issue a law, laws only go so far in behavior change, as we've seen on many different issues. Persuasion is what works best. UNICEF has worked on polio for many years now, and we have seen that where we've had successes, it's when community members themselves become volunteers to talk to their neighbors about the importance of vaccinating their children against polio. That's what works the best. So it requires intensive effort in pockets where that understanding doesn't exist, where there is no knowledge about what polio can do to a child's life. But we have shown repeatedly that it can be done with a lot of workers that are at the grassroots level reaching communities. So persuasion is what will result in change and what will result in sustainable change. Force has never worked to make change happen and to sustain it over time.
Thank you. Because health is at the concurrent list, and governors and local governments, in fact, are closest to where implementation takes place and are responsible at the end of the day. So, but we can't stand aside as federal government and let women and children to continue to die. That's why when it comes to immunization, for instance, or maternal and child health, the MSS intervention, every day we don't act, mothers die. Children get infected with measles or polio or some other thing. That's why federal government intervened. Now that intervention would not have succeeded without the support of the states. In 2009, all the 36 governors signed a commitment, which we call Abuja commitment, which we tracked, and the governors forum included it within their own peer review mechanism. Today's event was preceded by a consultation with all the states around the saving 1 million lives, and they bought into it. And the governors forum confirmed that, because the DG spoke on behalf of His Excellency Rotimi Amechi, endorsing and really affirming the support of all the 36 governors around this initiative. We consulted widely, the commissioners were part of it, but even the states by themselves can't do it. Only a third of total health expenditure in Nigeria comes from federal, states, and local governments. Most of health expenditure comes from private out-of-pocket spending. So it's all of us working collectively. Now, some governors obviously are more committed, and some governors can do even more. We want peer pressure to encourage governors that are not doing enough to do even more. And the scorecard that I showed, which we have for each state, will make them available. And we hope civil society, general public will apply pressure state by state to expand access to maternal and child health, to expand access to routine immunization at the state level, to expand access to PMTCT at the state level, because that is the role of citizenry and civil society as well. And that's the issue of accountability, which is mutual between government, private, non-governmental, development partner, all of us working together with good information to hold each other accountable. So I believe that the leadership of His Excellency Mr. President is really being followed by the Governors Forum, and we hope over time to see the governors respond as they've committed, and some will come faster and some will come from behind, but we'll support them. The local government chairmen are also equally important, and like His Excellency mentioned, this afternoon his meeting, in fact, I'm about to say that we're getting out of time, at 2, his meeting with local government chairmen, primarily to emphasize, even though constitutionally, federal government cannot direct the local government to do A or B, but that's what leadership is about. His Excellency is providing leadership so that others will follow, and we believe that others are following. And linked to it is the issue of polio. 94% of local governments in Nigeria have had steady improvement in their population immunity. And this year they have not had a single case of polio. Only 6% of local governments have had almost not improvement in population immunity. They are the ones that His Excellency is going to meet with today, because they are the last frontiers in our fight to eliminate polio. So the fact is we are succeeding in our fight to get rid of polio, but we cannot succeed until all of us are committed, and those remaining 6 local governments are now on the spot, because His Excellency said they will not sleep. And so I think that's sort of the direction that we are going on this effort. I'll take one more round of questions, and then we'll have to close, because I have to run to the other meeting that Mr. President is holding with local government chairman, and then we'll stop there.
My question goes to the Norwegian Prime Minister's rep. You promised that your government is going to assist Nigeria with $25 million, subject to approval by the Parliament. If we go ahead to plan around this money and it's not approved by the Parliament, what happens?
Good afternoon. My name is Colin Solanka. I work for Guardian. Sir, maybe if the National Assembly people were here, we would have been much more better. But since the Minister of State is here, maybe you can take our message to the President. I'm worried, and my worry stems from the fact that all of these programs will be executed at the grassroots level, the world level. And we know that the system of government at the lowest level is not stable. Now, you discuss with the chairman today, and tomorrow the governor removes, put a caretaker chairman there, who may not even last 2-3 months.